And good morning, everyone. My name is Dan Rogers. I'm the Executive Director for the Kelowna Chamber of Commerce. Welcome this morning to a special edition of what we refer to at the Kelowna Chamber, Business Smarts Online. Used to be minus the online function, but like most, we've made a rapid shift in the delivery of our services and programs. We're very pleased that we have a large group joining us this morning for what will be an informative session. And we're extremely pleased to have a couple of local representatives from WorkSafeBC who have had their world changed like all of us and have been extremely busy. They're here to provide some information around BC's restart plan. Kira Berntson and Shawn Mitton are the co-managers for the Okanagan and Kootenay Region at WorkSafeBC, and I'll more formally introduce them in just a moment. I want to thank everyone that has joined us throughout the region. We have a lot of folks through the Okanagan. We are collaborating with our other chamber colleagues in every community up and down the valley. Under the OK, we've got this initiative to signify the resiliency that we have and the spirit of cooperation and entrepreneurship that has made this one of the fastest growing regions in the province and one of the best places on the face of the planet to live. And it's being tested right now, that cooperation, as we deal with the pandemic, as many others are doing. On behalf of the Kelowna Chamber, I want to thank all those that make the work that we do possible. We're a federally incorporated not-for-profit. We can't do the work we do without the support of our members and the business community. Particularly want to acknowledge our President Circle members, Interior Savings, BDO, the University of British Columbia on the Okanagan campus, and MMP Accounting Consulting. They are pillar members of the Kelowna Chamber. They help us do the work that we do. Joining us this morning, we have a number of guests, including the co-managers for Okanagan and Kootenay Regions, and the provincial prevention field services at WorkSafeBC. Kira Berntson is here in Kelowna. Shawn, I think you're in Kelowna, but Shawn Mitton has also joined us. We'll introduce them and you'll see them in just a moment. Shawn is the prevention manager at WorkSafeBC and co-manages the region with Kira. Shawn's background is environmental science, health sciences, and occupational health and safety. Shawn has been with WorkSafeBC for 29 years. And now after this pandemic, he can now say, I've seen it all. And he's been involved in hospitality, tourism, small business, Avalanche program, BC Wildfire, young workers, and the seasonal agricultural worker program. Kira is a prevention manager as well at WorkSafeBC. We're pleased that she's joined us. She studied engineering and psychology before working in a variety of design and health and safety related positions in manufacturing, nuclear power, oil and gas, and other industries. Kira has been with WorkSafeBC since 2016. And as mentioned, has been co-manager for prevention in the Okanagan and Kootenay region since 2019. Also joining us, Jeffrey Robinson, who's the president and chair of the board here at the Kelowna Chamber, Representative Rush Ihaz Hardwick LLP. We're pleased that Jeff has been able to join us as one of the panelists. And Mark Burley, the representative of a very large organization in downtown Kelowna, the executive director. Mark, Jeff, thanks for joining us as well. Before turning things over to our representatives from WorkSafeBC to get the conversation going, we want to continue it beyond just today. So if you're on social media, please use the hashtag #OKWeGotThis. There are lots of resources available. I suspect we'll dive a little deeper into the resources available through WorkSafeBC, but some other useful tips. We have folks on the board that are on the call here today that have access to information. There's some really useful information at a variety of sites, including the one at the Kelowna Chamber. It's a rather long URL, but just wanted to leave you. You can check out the Chamber website under our COVID response, under advisory resources. We actually put together we call it the Fab Five. It's a helpful tip sheet to just general areas that anybody looking at startup, it's a one-pager. It can help you. It's just taking some of the information and putting it together. So everyone's trying to do their part to be helpful in this challenging time. At this point, I'd like to turn things over to Kira to start things off and welcome all our panelists this morning.
Right, well, I'm actually going to ask Shawn to introduce himself first, and then I'll hop in with the presentation.
Excellent.
Well, thank you for the opportunity today to come in and review with you what WorkSafeBC has been doing with regards to COVID-19 and to hopefully answer some of your questions around how do we get restarted, how do we reopen, and what are some of the tips and guides that we'll have available for industry as we move forward. And Kira will go through some of that in the presentation. I hope we'll be able to answer all your questions. If not, I'm sure we'll be able to refer you to the appropriate parties that have the information for you. And I'm glad to hear the Chamber's done an excellent job at putting together the Fab Five and getting resources out and available to industry. Everyone's going to need support and guidance and help to get this moving. And we hope that we're available there for you to if not give the right guidance as it relates to the regs, help move you in the right direction to the support you need. So I'm happy to be here, and thank you for inviting us.
Well, thanks very much, Shawn. And I suspect as we go through, we're all experiencing diving deep in this technology, and so we're working through some technical issues as well. We expect things will work fairly smoothly, but appreciate the patience of folks that have joined us. And we have a large number that have joined us. Just to note, we are recording this, and we will make it available afterwards on our website, provide some links so people can go back to the information that is being discussed. Please be aware, if you are an attendee this morning, you can use the question and answer function. It's on the menu bar at the bottom of your screen. You can ask a question of any of the panelists, certainly focusing on the representatives from WorkSafeBC, but we'll get to those after the presentation. And if you want to use the chat function for your question, you can use that. I'll be monitoring that as well. But for the most part, use the Q&A and ask that at any time, and we'll work through the questions as they appear and as they come in. So thanks, Shawn. Switch over to Kira.
Okay. Sorry. I just got a warning that my bandwidth is low, so if nobody has any great concerns about it, I'm going to stop my video just to make sure that you can hear me at least.
Sure.
Okay, so I apologize, but I mean, you've still got all these fabulous faces to look at as well. So just very quickly before I get going with the presentation, as mentioned earlier, my name is Kira Berntson. Shawn, Mitton, and I have been co-managing Okanagan about 8 months now, and a good chunk of that trying to coordinate while working from home. So we have gotten pretty good at just bouncing back and forth on things. But that said, I will ask you to please be kind. We have not had an opportunity to rehearse this together, being as we're both home isolating. So hopefully it will go well. The other thing I did just want to say is to thank all of you for taking the time to talk to us, and to let you know there are some links included in this presentation. I will be sending those to Dan and Heather following the presentation so that they can share them with you. Okay, so I hope everybody can see these slides now.
Yep.
And as we've already done the introduction, I'll just skip over this slide and tell you a little bit. So in today's presentation, we're going to give you some basic information about understanding COVID-19. Some of this is going to be repeat for many of you because certainly in the news already, but just want to make sure we're all starting from the same background. Talk about some methods of controlling the risk and some expectations around that in the workplace. I'll maybe ask for a couple of questions then, and Dan or Heather, if you can let me know what the feedback looks like on those, because I can't see the chat screen anymore. And we're then going to talk about some of the WorkSafeBC specific resources and other resources available, and then hopefully leave you guys a lot of time to ask Shawn and I some questions. So coronaviruses generally, they are a large a large family of viruses that we've experienced for years, the common cold and the flu, but COVID-19 is a new experiencing now. Got a wide variety of symptoms and can lead to severe respiratory illness and even death, particularly in older people or people with underlying health issues. But we are deaths, unfortunately, in all ages and health conditions of people. So you're never going to, maybe not even know they have it versus who's going to, unfortunately, experience a very severe form or pass away. Some of the most common symptoms are coughing, sneezing, sore throat, difficulty breathing, or chest tightness and pain is something you can also watch out for. Fever. Just a little warning with fever. A lot of people think of fever as a specific number, being, normal body temperature 37, and a fever is around 30, high 38s or 39. There are variations in that. So for example, my normal body temperature is actually down around 36, 35.6 in that range. So for me, 37 is actually a fever. So just something to be aware of if you are using fever as a monitoring for your employees. Some other symptoms that can include muscle fatigue, headaches, loss of appetite, nausea, chills, vomiting, diarrhea, losing sense of smell or taste and so some of those things are things that you wouldn't necessarily associate with being sick and things that you need to make sure that anyone working in your premises is aware of so that they know, if, for example, you're having really bad diarrhea and you can't really smell for a few days, that's actually a stay home thing. That is potentially COVID. So pardon me for the slightly graphic terminology there. Some people may experience little to no symptoms, which is one of the things that makes COVID so dangerous. It's spread through infected droplets contacting surfaces in the eye, nose, or mouth. So liquid droplets in the air when a person sneezes, or when you touch a contaminated surface and then touch I'm sitting here gesturing like you can still see me, just realized. So if you touch a contaminated surface and then rub your eyes, for example, might be a way that you would wind up infecting yourself. Also, if someone has used their hand to cover their mouth when they've coughed or sneezed, and then you shake hands with them. So that's one reason why we actually encourage people not to shake hands. I know we have a really great theater district in Kelowna, so jazz hands is definitely an acceptable greeting nowadays as an option, I guess. Sorry, I'm trying to be funny, but I'm not sure if you guys are actually laughing.
Part of the challenge, Kira, just
anyway,
to be aware, is just your audio is cutting out, so it's reasonable,
okay.
But just if we lose you, I might have to yield to Shawn, but so far so good.
Yeah, if you need me, Shawn can absolutely take over 100%. I am sorry, I'm not in as good a neighborhood for internet as Shawn is, unfortunately. So some of the factors that increase transmission, challenges maintaining 2 meters of distance. So if, for example, you have people working on a line where you can't spread the work out, that might be a challenge. If you're doing garment fittings and actually have to touch a customer, that might be something you need to consider. For example, if you have like a wedding dress shop or something. High frequency in the workplace. So if you've got a lot of customers coming in, which I'm guessing a lot of your members do, or a lot of clients coming in, as opposed to just the standard office staff. Potential for working in enclosed areas. Well, actually, I guess you can read all of these yourself. And also potential for regular contact with shared surfaces is a significant thing. So if any of these exist, I want to consider when you're developing your procedures. And of course, if anyone, you or anyone working for you experiences any of the symptoms associated with COVID, they should inform their supervisor, preferably via a safe distance of more than 2 meters. Stay distant from the workplace and seek medical advice from a healthcare professional. And they should consult with a healthcare professional before leaving for work. I know this is in some cases easier said than done. People are, of course, concerned about financial stability. People are also concerned, about letting their colleagues down. So it's really important to remember you're not letting your colleagues down by going home. You are actually supporting their health and wellness. So as we hop on to the next section, are there any quick questions before I go on?
I think that we have some questions coming in, Kira, but we'll move through this, and then we do have 11 slated to go to, so we want to get to as many questions, but we'll hold those off until you make a presentation, then we'll get into the discussion.
Okay, perfect. So just generally, if you guys can tell me what's coming in here. Do you guys have the people that are participating, your workplace, do you think you understand the risks and how it applies to your work site? You understand the risk and how to effectively control it? You understand the risk and how to effectively control it? I think there should be an option on here that says we're also implementing effective measures, but that's not on here. But I'd like to get an idea of how you feel your level of understanding in your businesses is.
So we do have a poll function that we're not going to use, it just sensitive to time. And based on some of what we're hearing, there's a little bit of folks that are in all three of these categories, though slowly moving through that into developing their plans. And I suspect we'll get some of that feedback when we get into the questions and answers.
Okay, perfect.
And
okay,
if you just so aware that for the attendees, there is the chat function. So if you do chat to provide some feedback to our panelists, please feel free to do so. We've had a nice comment with respect to Sarah making comments around they're already constantly reminding their employees and making it part of the working practice of making note of paying attention to whether there are symptoms that are arising. So for the most part, people are understanding the risk and implementing the controls as noted, and we're moving through that phase about planning and getting set to reopen. So hopefully that helps.
That is great, yeah. So as far as the basic control measures at a very basic level, of course, follow the orders, notices, and guidance from the Provincial Health Officer and the BC Centre for Disease Control. At a really basic level, you're talking about making sure you maintain your physical distancing, making sure you're cleaning and disinfecting regularly, and of course making sure you're maintaining personal hygiene, such as covering your coughs and sneezes with a tissue or using your elbow, washing your hands, avoid touching your face, which is surprisingly difficult to do, as I'm sure you've all noticed, and not sharing foods, drinks, or other items. So in terms of the controls you can put in your workplace, in terms of most effective to least effective, just like with any other hazard, chemical, biological, whatever, of course, the most effective is to eliminate the hazard or substitute in some other way. So working from home, as most of us are many of us are doing right now, rescheduling things so that you are doing tasks after the customers are gone that don't need to be done while they're in the store is another potential way of substituting or eliminating. Keeping people separate. I don't know, you've probably seen some of the graphs where they're doing the pictures where they're doing the manicures through the mail slot in the door so that the contact is absolutely minimized. That's not really elimination, but that's kind of just the thought. Then there's engineering, which is having the barriers. So the plexiglass barriers we see in a lot of the grocery stores would be an physical engineering barrier. Things that basically are designed to prevent contact with the worker. Administrative controls, so that is where we talk about the little arrows that are pointing you around the grocery store right now. grocery stores are just a really good example to use because they've done a lot of work. Posting signs that say we're limiting our occupancy to X number of people, reminding people or hand washing stations throughout the business and those sorts of things. And of course, the least effective control, but one that you can still use, is PPE, so gloves, masks, and those sorts of things. Depending on the risk level, respirators or face shields may be used. Businesses, I think, are probably not going to require that. Like most of the businesses you have are not going to require respirators or that sort of thing. The main thing to remember when wearing the masks is that you are not protecting yourself with those surgical masks. You are protecting the people around you from your breath, with your moist breath. I'm sorry, I hate to use that term, but the liquids in your breath, the water droplets in your breath. So there was another poll put in here. The poll, I'm just going to ask you all to think about which controls you are using or can use in your workplaces: elimination, substitution, engineering, administrative, personal protective. Not using controls is probably not going to work business where there's only ever one person in the business, sort of thing. So what should employers do? Well, first of all, determine who actually needs to be in the workplace and create policies that are in line with that. So, you may be looking at implementing policy that would require anyone with symptoms to isolate from home for a minimum of a certain period of time. Following those things, you might also be looking at, are there people who can do things remotely, and also in terms of your clients, do you need to take steps to control if there's someone with symptoms potentially coming in. Consider, of course, the engineering controls, so the plexiglass barriers. There was a clothing store that we went to that talked about having the customers basically look around the store, tell the staff what they want, the staff would gather and put it in the dressing room, and then the customer would go in and try it on with the staff member far away, so that people weren't touching multiple surfaces. It's a little bit, seems like a bit of a challenge, but it's certainly something that does help with, if there are never two people in the same room or area. So again, also looking at how are you setting the space up? Can you spread the racks out, the rows out a little bit potentially, or can you, have it all one-way traffic going through so that people aren't crossing back over each other? If possible, stop in-person meetings. Of course, we're not saying stop your joint health and safety committee meetings and your safety meetings, because those are very important, but maybe if you can do them over the phone, on a teleconference, over Skype, or Zoom, or Teams, or whatever platform your business is comfortable with, and look at changes to work practices and work processes. If you have staff that work in vehicles, delivery drivers, probably a lot of those out and about right now as people are ordering things from stores instead of going out. But working in vehicles, limit non-essential work travel, limit essential and ban non-essential travel for work. Where it is, consider practicing physical distancing. At WorkSafe, for example, our officers are still going out into the field. Where we do require 2 officers at a site for whatever reason, they are traveling there in separate vehicles and maintaining physical distancing at the site and those sorts of things. And of course, regular cleaning. You want for groceries that a lot of the stores are cleaning the tills off after every customer goes through. And it's going to be the same thing, surfaces that are shared. Develop the cleaning practices and make sure that your staff are trained on them. Documenting them is great, so you know how frequently it needs to be cleaned and how frequently it is being cleaned. Shared items that don't need to be there, get rid of them. And of course, high contact areas will need to be disinfected more frequently. And we talked a bit already about this, but the Joint Health and Safety Committees, so they are a great source of ideas and resources for you as well. That is their goal, their point, is to, of course, provide you with information and feedback. So if you have a Joint Health and Safety Committee, get them to help you identify and find solutions for your workplace health and safety. have them raise concerns about the COVID. They do need to continue to meet regularly, but of course the nature of those meetings is going to change. And of course, what workers should do, they need to know when to come to work, and they need to know that it is not only okay, but important to stay home if they are experiencing symptoms. They need to follow preventative measures, so they do need to follow the employer's instructions around the hygiene, the physical distancing, any barriers or admin procedures you're putting in place for health and safety. That's really important. They also need to report hazards and, if necessary, refuse unsafe work. There is, I just have to say, a very specific process for refusing unsafe work that I'm going to go over quickly, because it is something that sometimes people don't know. And it is really important also that your workers know this, because we have unfortunately had workers call us and say, hey, so I refused unsafe work and went home and now they fired me. And it's like, well, yeah, because you didn't follow the process, you just walked out. So the process is a worker will tell you that what their concern is specifically, or the supervisor. The supervisor needs to look into it. If they determine that it is safe, they will tell the worker that. If they determine it's not safe, they'll take steps to correct it. At that point, if you still disagree, you get a member of the Health and Safety Committee or another worker, if the member of the Health and Safety Committee isn't available, and look at it again. And if you still can't come to a conclusion, then you'll call WorkSafe, and WorkSafe will make the final conclusion as far as whether undue hazard is present. So it's a few steps process, but it's really important that they follow those processes and you follow those processes so that you're all protected and you're all on the same page. They put a few polls in this slide. So I'm not, again, since we're not using the polling function, again, just think about how effectively you are, or what you could do to control risks more effectively if you are not currently controlling the risks in your workplace.
Kira, I think it might be relevant just to note, and our apologies, we don't have the poll function working. We have such a large number participating, but those questions really illustrate the need for businesses, employers to reflect on their communications. And one way to get a conversation is to ask those very questions so that you can monitor over time. Good communications internally, externally with your customers, your supply line, your vendors is an absolutely critical piece. When we mention the five areas you kind of need to generally focus, underlining all of that is good communication. So I just wanted to note that if people want to provide their feedback through the chat function on that poll question, but it's also a conversation starter, which is really good for businesses to consider.
Great, thanks so much, Dan. That is really great context, yeah. So as far as returning to safe operation and how WorkSafeBC is going to be involved, to be very clear, WorkSafe is not going to be reviewing or approving plans of individual employers, but we will ask you about the steps that you're taking to go out there and we are going to be engaging workers, employers, industry, and other stakeholders to help them understand the measures that they need to have in place. And we are actually in the guidelines that are being developed, and in some cases have been developed and are soon going to be posted on our website that are industry specific. We have been reaching out to industry groups, so we have been, making sure that we're getting your input as well as our own in terms of what. There's general guidance available right now, a six-step analysis and determination process to make your plans to safely open your business. And of course, to say the specific resources are being developed as we get industries ready to reopen. There is a package on WorkSafeBC.com, which is a general guide to help you in developing your plan. The plan should look at how your workplace is organized and arranged, some of the specific activities that you carry out, how you clean and sanitize, any changes that you think you need to make. So on our website, it will walk you through the 6 steps I talked about, which is, first of all, assess the risks at your workplace, implement measures to reduce the risk, determine what those measures are, develop policies around who can be at the workplace, communicate your plans and train your staff on those plans, monitor the workplace ongoing and update those plans as needed. Ongoing monitoring and updating is definitely really important, because as we get into this, this is new for all of us, really. So we're going to be learning as we go. And of course, there's assessing the risks from resuming operations. So after telling you all the things that you can do, I'll tell you a bit about what WorkSafe can do. So WorkSafeBC is continuing to monitor the outbreak and adjusting our response as best we can to make sure that we're supporting workers, providers, and employers around the province. On our page, WorkSafeBC.com, there is now a banner at the top that is COVID-19 specific. Right here where it says revised workers' comp, actually now is the returning to work section, and that's where you'll find the return to work documentation as it gets added to the website. So we've made it as easy as we can for you to find. And of course, we are committed to continuing to provide the services that we've always provided, and doing the best we can to work with you to make this province as safe as we can. So these are some of the online resource links that I'm going to be sending out later. General health and safety information for employers. We've got preventing exposure to COVID in the workplace, which is the guide to assess risks and put controls in place. We have some general information about staying safe at work, some frequently asked questions. There's an industry information page, some specific industry information pages. Also, our prevention field officers and our consultants are going to be reaching out to businesses for inspections, education, and consultation where we can. There's a prevention information line, so please, this number is on our website, but write it down, keep it handy, because our officers are always willing and happy to talk to you. We have a large number of officers across the province who are assigned to answer questions on this line right now, which is the 1-888-621-SAFE or 621-7233. So if you call that number, one of our initial triage people will take your question down, get it off to an officer, and an officer will call you back. Generally speaking, our call return times currently are within the hours. So, do feel free to reach out to WorkSafe with questions, please. If you do have a worker that needs a claim, and that includes anyone who has a work-related case of COVID-19, existing claims are continuing as normal, managed. So there's not really any significant changes there. If you have a worker who needs to file a claim, they can still continue to report it. It's going to be online or via phone. We'll still be registering, adjudicating, and making payments on lost time claims. Please, there is a FAQ question, claims facts on WorkSafe if it is a COVID-related claim. Unfortunately, Shawn and I are both prevention, so if you guys do have questions about claims, we will probably have to take those questions away and have someone from claims get back to you, but we so some other available for you. There are several web pages out there. Besides WorkSafeBC, we have BC Centre for Disease Control, the Office of the Provincial Health Officer, HealthLink BC, and the Self-Assessment Tool. All of these links are also available in the COVID links in this presentation to Dan and Heather, so that they can send them out to any participants who might want them. There is a COVID information line for non-medical information at 1-888-COVID-19. And of course, the BC Health link if you are not feeling well. Those numbers can get kind of busy, but they are definitely there and available for you. Resources for employers and visitors are also available at the BC CDC. There's a business continuity planning checklist the government of BC has. Small Business BC has some support services for BC businesses, and the Canadian Centre for Occupational Health and Safety has some online products to help you with assessing your workplace as well. So We are trying to have links to all of these things as we find them on our website to make it one-stop shopping and as easy as possible for you. And again, any links that I do have, I will be providing. This is what WorkSafeBC is working on. Please don't share this terribly broadly, but this is as of, I believe, Tuesday where we were. So our 6-step process that we had talked about was complete. We are working on planning tools, which is a form that you can fill out. It may already be on the website, but putting together a basic plan that walks you through the 6 steps where you actually check yes, no, or fill in the boxes. As you can see, this is a slightly older one. It's as of Wednesday, May 13th, but looking at some of these specific industries, getting specific planning tools, and have you considered this? You might want to look at this. This is what we consider best practice for your industry. Again, we're not going to say this is what it must look like, because you know what your workplace looks like. You might have something in your workplace that we're not familiar with until we get out there and look at it. We're also putting together some tools, primers on selection, care, and use of masks, as well as cleaning and disinfecting practices. Those are showing us 3/4 done. I believe they are actually complete now. If they're not on our website, they will be by tomorrow. Some signs that you can use, those are on our website with occupancy limits, hygiene, use of masks. So those are complete now on our website. And we've also got a risk advisory that coincidentally we were working on through our risk advisory unit about standing water systems and the risk of Legionnaire's disease. And that's definitely something, if you have water systems or water that's been standing in your business, that you're going to want to think about when you're reopening. COVID is of course a concern, but so are, you know, germs that may have cropped up due to your business being shut down for a while. The last thing I want to stress, it doesn't say it in my bio, but I'm the prevention manager of interest in BC for psychological health and safety, and we're working on developing, of course, some resources for you there, separate from even the COVID pandemic, and hopefully we'll be working with all of you a whole lot more on this in the future. But during a pandemic, of course, people are stressed. Things are changing so fast. People are uncertain. And some people actually are handling this very well. Other people are struggling. Everybody's going to handle it in their own way. So there are resources out there managing COVID-19 stress, anxiety, and depression through the Ministry of Health and Addiction. The World Health Organization has some resources around psychosocial considerations during COVID-19. Canadian Mental Health Association has some really great resources, Conference Board of Canada and the Public Health Agency of Canada. We do also have psychological safety resources and links on our website. But as Dan said, communication is key, and communication is really key in just being very open about psychological health and well-being as this is going on. As scary as that topic might be for some people, it's really important that your staff knows that you are there to support them, and that you guys are supporting each other as well. And please remember that we are there to support you as well, and try to get you as many resources as we can to help you reopen as effectively and safely as you can. And now we are at questions.
Thanks, Kira. So you can perhaps stop sharing your screen and we'll bring the group back. Thanks for the presentation. We'll bring Shawn in a little bit on this. A couple of quick hits that I wouldn't mind getting out of the way. A couple of comments in the chat function that came up, and it's relevant to a couple of slides. With respect to the employer's responsibility, one, if someone leaves because they don't feel well, is the employer responsible to provide that information to government that someone has left, or if they are, or is it the individual's responsibility to report? Are you able to either one respond to that one?
Yeah, so I mean, there's, from WorkSafe's perspective, if a worker, you know, has an illness that's reportable, then they should be reporting that to their employer, whether it's supervisor or their employer or manager, indicating now they may have a sick leave policy or another program under HR that would cover some of that. But you know, what we would typically say is if they believe it to be COVID related, there's some certain specific rules that have to fall into place around self-isolation and ensuring that they they report to public health. So there's some specifics the employer will need to know to do that. And then if it is considered to be a work-related injury, then of course then they can report that as a work-related injury to WorkSafeBC.
Just to be clear, Shawn, I think the kind of the question was, if someone that's under my employment gets COVID, the individual is responsible for informing health authorities, not the business, unless in some circumstance it was a work-related. Is that what you're saying?
Yeah, from the compensation side, but from the public health side, I think there may not be a requirement for the employer to report, but if they had a worker that was exposed or they believe to be exposed, then they have concerns for their exposure to their fellow workers, right? So there's probably a good idea to get a hold of public health and then between the worker and them determine what the next steps would be.
There was another quick comment in the chat, and we've got lots of questions we'd like to get to here. What are your thoughts on workers traveling between provinces? And it's relevant given the regions that we operate. There's so much back and forth between Alberta and BC. Is that an area of focus or any guidance or comments you can make with respect to that?
Yeah, I think we would refer to the public health officers' rules around transfer of people across provinces. I mean, that would be the same if they're coming up from Vancouver to Kelowna and they're starting in your workplace. You would want to make those checks of, have you been overseas? Have you been ill? Is there any situation in which you would have been at risk of exposure, and go through those questions. So I would refer them to check with BC Health and then look at it from that perspective as a new employee, and then going through those checks and balances. That's what BC Construction is doing on a regular basis as they move people in and out of their job sites. Great.
So I just wanted to jump into those ones. There were quick comments within the chat function, so please feel free to do that. But for the most part, if you could use those that are participating, the question and answer. Kira, Shawn, are you comfortable to jump into general questions and answers at this stage?
Sure.
Yeah.
All right. To start things off, maybe I'll just go to Jeff and Mark and concurrently just for some questions. Both are very active in the community and are connecting with other businesses, organizations, even within the work that they do on a day-to-day basis. So Jeff, perhaps, what are you hearing the greatest concern in those that you're engaging that might be helpful for Shawn and Kira to respond to?
Thanks, Dan. As you know, the Chamber has been reaching out to its members. We've contacted hundreds of them, really since the outset of this outbreak. And I've noticed a shift in the feedback just in the past week or so as people look towards reopening. And the major theme I'm getting is that people aren't sure what guidance they're waiting for. And so the question I think a lot of businesses are facing now is, are we to reinvent the wheel and develop our own policies? I noticed in Kira's slide, it said employers should develop policies. On the other hand, we hear that industry-specific guidance is coming, and one of Kira's slides listed off, I think I counted 10 different industries where we can expect guidance. And so as a business owner, I think everyone who owns a business wants to know that they're doing the right thing. And the best way to show doing the right thing is to take something from authority, whether it's from Bonnie Henry or from WorkSafeBC, share it with your employees, share it with your customers, say, look, here's what the experts have said, here's what I'm doing. That's hard to do with general guidance. And so what I would like to know is, where can a business find out if they're going to get specific guidance for their particular business? And then who is going to provide it? In Kira's slide deck, it suggested that WorkSafeBC is coming out with the guidance, but I've seen on the Provincial Health Officer's website, there is already specific guidance. For example, hotels was recently posted. So who is going to tell us what to do, and how can a business be sure they are going to get guidance that is specific to them?
So all the protocols we're putting together for industry currently are based off the foundational guides of the Public Health Officer of British Columbia. So those guidance, if they have come out with information specific to opening of hotels and everything, we would follow that as well and ensure that ours, as it relates to workplace health and safety, reflects the important pieces of the foundational elements of the Public Health Officer. So the specific guidance that we're having out there for industry is basically around those foundational elements, as Kira had showed in the slide. You know, are we able to eliminate the risk to COVID? If we can't, are we then putting engineering controls or some other administrative control in place? And so this is the challenge of putting together a guide for every industry, is every industry and every job site is different. So I think what employers could do is look at those foundational elements and say, walk through them and you know, with regards to questioning themselves, you know, can I engineer out this issue? Can I put up barriers or restrict and design away exposure risk to my workers as it relates to COVID? And if I can't, how am I then going to restructure my workplace to minimize those through administrative controls as far as distancing and sanitation and those? So throughout the presentation, those are the foundational elements of putting together a plan, is asking yourself those questions. And on our website, you know, right now we have some guides specific to industry. If you open them up, they're pretty much the same for each industry as asking those questions. Have you been able to recognize the risk, determine what I need to do, evaluate it for my specific industry, what does it mean for me, and then how do I protect my workers and protect the public that are coming into my store? Now, that's, you know, not the perfect answer for any business. It's a challenge for everybody, and that's why WorkSafe is trying to help alongside public health to put certain guides in place to say, please give that a thought. And if it becomes a situation in which you are challenged, then, you know, reach out to us and we can help provide some guidance or some information to help you move in that direction. We're not, as you know, the slide says, we're not approving plans, but what we do is sit down and help an industry try to figure that out. So I know it's not the answer that, you know, you want to hear, but or maybe the perfect answer, but we are aligning with Public Health Officer of British Columbia, and then ours are related to workplace health and safety specific to your risks in your industry.
So is it fair to say then that you would encourage businesses to check both the Public Health Officer's website for guidance and also WorkSafeBC's website for guidance, and then use the most specific guidance they can and follow the guidelines as it suits their business?
Yes, I totally agree. When we go out to industry, we'll be doing the exact same, and that's why the public health officer's link is actually as part of our presentation, is because I think you need to go and check that on a regular basis.
With us, Shawn, Mitton, and Kira Berntson, the co-managers for Okanagan and Kootenay for WorkSafeBC, prevention managers. So thanks for joining us. I'm going to switch over to Mark Burley. We have many in the restaurant sector, retail sector in the downtown. Mark, what are you hearing on the streets, the concerns as people are now starting to think about getting their plan and then starting towards that reopening phase?
Yeah, thanks, Dan. It's a lot of the concerns actually from restaurants and retail and salons, barbershops are much of what Jeff was asking about. And that is, everybody's looking for somebody to provide them with a basic set of protocols. So, you know, you have restaurants who are asking, well, how do we keep physical distancing with our servers? And, you know, we can all do, like the Premier said yesterday, use an educated guess on what that's going to be. And that's probably a mask and, you know, gloves and that kind of thing. But that's fine in that restaurant thing. But what about the hairdresser or the barber? And those are the two sectors actually that are asking, where's our guidance? Now, the BC Restaurant Federation has done well with documentation that they've put out, but there's so many different sectors here in downtown Kelowna, from service industries to barbershops to salons to retail to restaurants. But the restaurants and the beauty sector or cutting of hair and that, they're the ones who are really looking for some guidance and they don't know where to find it.
That's a great question. Yeah.
The question is then, is the guidance coming? I know Shawn and Kira in the presentation said you're working on that. Everybody's impatient, understandably, but those are the guidelines, the two industry sectors that are really asking a lot.
Kira, do you want to take that one?
I mean, I guess the short answer is yes, the guidance is coming. Hoping to have it up this week, but I can't confirm that 100% because you know, I mean, we're developing it, as I said, in conjunction with the provincial health office, as Shawn said. So absolutely, the guidance is coming. We're getting it out as quickly as we can. We've pulled a lot of our people off of other things to just work full time on getting this guidance together for the industries. So. It will be very similar to the 6 steps, just with some more specific considerations and questions for the industries, and some more specific thoughts for the industries. So I guess the short answer is yes, the guidance is coming for restaurants and for hairstylists and barbers.
One of the things I want to build on for a moment, and Kira or Shawn, language is extremely important. And we're seeing that you had a hierarchy, a slide of controls and influence. From a military perspective, almost the hierarchy of orders. What's not clear is, will all of this be guidance? Or as an example, in the personal services where that social distancing can't occur, will it be a requirement? And is an order, requirement, recommendation, guideline, you go on the hierarchy of thou shalt must, thou shalt consider, and these are some other best practices. So it's a bit of a hierarchy, and what we don't know when what we're hearing is, as an example in a hair salon, will they and their employees and their customers potentially be required? Is that something, or will it all be guidelines? Can you give us a sense, or when that will be clear?
Yeah, so with regards to our involvement with industry, or back to just quickly on Mark's question, our consulting and education services groups are reaching out to pretty much every association they can to work with them on what the issues and needs are for them. Of course, that group is a limited number of bodies, so we're working our way through a lot of those associations that have some of those concerns. So we'll continue to do that and reaching out to that group. So hopefully we'll be able to work on those issues at that end. As it relates to guidance, there's an expectation from the public health officer that people follow the guidelines as laid out by them. We will be, when we go out and have those conversations with industry, we'll be first taking a consultative and educative role to help them understand what the obligations and expectations of the employer are as it relates to this. The Workers' Compensation Act and regulations will require people to provide a safe workplace, so that's always the obligation of the employer. But as it's specific to COVID, we'll be working with them to assess those issues, make sure they've addressed the risks and done the risk assessment, and move towards that reducing the risk to workers for COVID. So the initial issue is, yes, it's a requirement to have safety protocols and procedures and guidelines and engineering controls in place as required. But we're not going to come out of the gate and go in and write orders or initiate any type of enforcement action. We're going to go out and work with the employer and guide them in getting to that goal. Because at the end, we're all in it, right, together. So we want to make sure we help each other move to the right path.
I'm going to go to as many questions as we can. We've got about 35 minutes, so a fair bit of time, and we've got lots of questions with our participants. One right off the top. I should disclose, I still get my haircut on a regular basis because I live with a hairdresser, so I'm fortunate in that. The other aspect is I don't have much of it, so it doesn't take long. But barbershops, time frame, and there's a couple of time frames at play, but just if you could quickly reference that, Shawn, time frames with the loud for the reopening as we move into phase 2, but then there's time that will take for people and businesses, I expect, to develop their own plans, do briefings, look at and developing those policies. But just, can you refresh the time frame for these openings? Someone asked if they can go see their barber right away.
I believe, and Kira, jump in because she's really good with numbers, but I believe that the public health officer has indicated that Tuesday of next week is when we start to move into the phase 2 groups, which is retail, barbershops, personal services, some hospitality and tourism outlets, and then phase 3 is looking into the mid of June. So
the next question we had was Kira wanted to add some more there, sorry.
Oh, no, I was just going to say, yeah, it's, I mean, the timelines are coming from public health and not from us, and they're going to be dependent on each individual employer, of course. So if your barber feels confident that they can open up and safely serve you, then you might be able to go see them on Tuesday. Others who maybe, just as an example, there's a number of restaurants that I've been visiting for takeout to try to keep supporting local businesses while we've been shut down. And several of them have said that they are not going to open up right away because they want to make sure that this is something that they're not going to call everyone back to work just to send them home again if numbers start going up. So, you know, each individual employer is going to be deciding for themselves within the public health officers.
Great. Just to note to those that have asked or posed questions, we'll try to get to as many of these as we can, but we will follow up afterwards. We are recording this session and we will capture the chats as well as the questions that are being posed and get circle back to get the answers that we can if we don't get to them on our program this morning. We're getting a lot of these questions around labor law, and I'm not sure how comfortable. We did have a labor lawyer and probably will have one back. Is the recommendation to stay home from work when they feel unwell in all cases? So is it applicable if you're not feeling well? I think it's pretty clear. The Premier said they should stay home, as the Prime Minister did as well. In all cases, or only if exhibiting potential symptoms related to COVID?
So we would take our guidance from the public health officer of British Columbia, which indicates that people that feel that they're ill, we would expect them to take the right steps in accordance with that rule, which would be to be at home.
Excellent. And I'm going to rapid fire some of these. They'll come through the Q&A. So one challenge that I'm learning is that many businesses are planning on reopening without having an industry-approved sector guidelines. It asks with respect to roles and responsibilities in the workplace environment, because there's multiple jurisdictions, and municipal role, local government role in some of this, or does it most of this fall to provincial responsibilities, whether it's WorkSafeBC, the health authorities, etc.? Just some clarity on that.
So I guess the fun thing with owning a business is you've probably got a whole bunch of regulators coming through your door to line up to ensure you're in compliance. So you would definitely want to make sure that you're in line with the fire commissioner and your municipal permits and your public health permits. The big ones as it relates to COVID would be the responsibilities under the public health order. So your public health office, local public health inspector, those would be people that would have some influence in how you set up your protocols and guidelines. And of course, with WorkSafeBC, the requirements are the employer to provide a safe workplace and put policies and procedures in place. So we would be expecting the employer to assess those risks, analyze what they need to do, and have some form of plan in place and be able, for us, it's not having a perfect plan. It's about being able to recognize the risks your workers are exposed to and having your ability to implement something that will protect them. And so we're not looking for the perfect thing. We're looking for you to do what you need to do in your specific workplace to address those issues.
Mark, I just wanted to follow that one up, and whether you're hearing from some of your members with respect to the role of local government in this. And I think the fire, and that's a great example. So thanks, Shawn, for that reminder. There is a role for some local government officials in the workplace environment, but are you hearing from your members? And we are seeing some communities around the province, Victoria, Calgary, Edmonton, looking at repurposing public spaces just to help businesses. Are you hearing a desire of consideration of that from some of your members?
Yeah, we've a lot of questions about specifically using sidewalks as retail space and patio space, as well as where a business is maybe situated beside a small park or a parking lot that's not overly used, whether part of that space can be claimed for retail and or food services. So there is a demand for that, and there is a lot of questions about it, and there are a lot of discussions happening with the city about that kind of thing right across the city, not only here in downtown Kelowna.
So Shawn, from a business perspective, if I have a small location that has restricted access, broadening that and using repurposing public space has some value. but I'm assuming there might also be issues that WorkSafeBC might be aware of. Are you involved in those discussions with local governments that are occurring, or is that under the privy of local governments themselves?
Yeah, usually the commercial permitting of space is done through your provincial government or local city officials, and we have an expectation wherever the work is being done that the employer, do those risk assessments and implement the right protocols. So we usually come in at the end of that process. We're not usually involved in the beginning discussions of it. Although I would, I encourage any advancement of moving business and though using those outdoor spaces better. Absolutely, that'd be good.
We have a very specific question with respect to the general guidelines of disinfecting regularly. Define regularly. And I guess I might pose this in the broader perspective if you want to make a comment of what's absolutely required and ordered. And when you have a state of emergency and there's an order, it's clear you need to follow it. But I think generally repeating, and if you want to just make a comment as well, some of this we're leaving to best practices and employers to make the right decision, and not going to absolutely define every hour of every day and what you must be doing. Is that the kind of the approach that WorkSafeBC is taking?
Yeah, we typically will leave this to the employer to determine the sequence of the cleaning regime that they have to put in place based on, the contact and the number of people and everything. The big thing I think when it comes to cleaning and sanitizing is the contact time, is making sure, as the public health office says, that your cleaning solution is left on the surface, on the foamite surface, to ensure that it gets a good cleaning time and contact time with any potential organic matter. And it's not just wiped off and dried off right away. So that's an important piece, is when you clean to allow that contact time for disinfection. The criteria on how often that should be done would differ depending on, the number of people, the risk, and how often you think there's a concern there to do that. And that would be that open discussion, as you say, Dan, around what are the issues that exist in each individual workplace.
Yeah, we've seen some of the comments from the Premier with respect to trusting those that are in businesses to know best to how manage. And as an organization, business organization, we do spend a bit of a time saying we need less regulations. We need to trust people. So we're caught in this quandary of those in the business that are asking for absolute direction on everything. And then generally we say we actually want less regulation. So we're trying to find that balance and appreciate, so far for the most part, BC has done a pretty good job on that. There are specific areas, and then the next question I wanted to talk about around policy for public access to washrooms at places of business. Is there some expectation of restricting access, employee use of those, or is that just as an example, which was a chat earlier on? I have a kitchen or a central area, so you need to flag where there's multiple points of contact, high traffic areas, and the washroom or a kitchen would be good examples of that.
Yeah, that would be good examples, and that's going to be the challenge for some industries and businesses, is high traffic areas like a washroom, and the fact that there are sanitation issues that exist there will require a lot of cleaning and a regime put in place to ensure the protection is there. Joint kitchen areas and things like that, you could use disposable type utensils. You could reduce the number of people that go there, maybe put in a calendar invite or some timing that allows people to go at certain times. So you can set up different ways to deal with that one in the office environment as it relates to a coffee area or something like that. But yeah, in your business, it's going to be setting up a regime that allows for you to maintain that sanitation, but still allow your clients to use the services you're providing. And sometimes the public health officer will, if you have a public health permit, if you're serving food, some of them will also have some requirements under the public health permits.
I think, Jeff, you had made a comment when we were chatting before with respect to understanding what businesses have to do. It appears there needs to be a plan. Is there a need, or Jeff, are you hearing, do you need to post that? I think you were asking that question earlier.
Yeah, so there is WorkSafe guidance saying every business needs its own plan. And as far as making that plan, I understand you're going to have guidance about how to step through the stages. Once a business has that plan, do you recommend that they share it with employees? Do they post it on the door of their business? What is the best way to make sure that plan is actually?
Kira, do you want to take that one, or I can?
Yeah, sorry. Can you hear me okay? I've got a bit of a challenging connection here. So WorkSafeBC, our legislation doesn't allow us to require you to post the plan. The Public Health Office may require that eventually, but certainly it is a really good idea to post the plan or some aspects of that plan, the most important aspects for, especially if you have a public-facing business, to make it very clear to them this is what's expected of you when you come in, and you want your workers to know what's expected of them as well. You know, having it posted, because these things are probably going to change and evolve, is I think pretty important to making sure everyone is on the same page in terms of what's going on as a practice.
Yeah, and I think to Dan, your earlier comment on communication, I think there's an opportunity there in which having a good plan or having a plan on how you're protecting both your workers and the public, being able to share that with your staff and even sharing that with the public is saying that you've got this under control. You've taken the appropriate steps to make sure when they step through your door that you've done everything to ensure they have a good experience. So there might be some positive to that as well. So.
All right, thanks. We're going to continue with Q&A, and we certainly recognize we're getting some leakage from audio, but I think it's part of this system because most of the folks are muted. So I'm just going to make some adjustment on the audio. Not sure whether, Shawn, that was leaking in from yours or not, but I was having a bit of a leakage, so I just put you on mute there for a moment. I'm just, there's a specific example of a question from a martial arts studio, and then you get into the, I think it's a good example of those areas where voluntarily they close down, they're seeking to reopen. They've talked with their provincial organization. They've been suggested that if they keep that social distancing and have protocols. Can WorkSafeBC, either you, Shawn, or Kira, make a comment with respect to those areas where it's a blending of a volunteer workforce? Sports organizations are a good example of this. We've got some members that would like to get back, so that's a blending of kind of volunteers and potentially paid or not. What are the responsibilities for those organizations, whether they're a for-profit entity like a martial arts school, or more broadly, those environments where people, even if it's in a volunteer basis, is that an area that you get into?
Well, WorkSafeBC does not, in most cases, have jurisdiction for volunteers. That said, we are certainly happy to give anyone in those situations our resources to help them develop really good plans. And as you did mention, one of the things we've noticed as we've been going out and looking for trying to develop the industry-specific guidance is that a lot of them do have some really good guidance already that we're drawing off. So those are great sources besides WorkSafe. They've been doing a lot of work on getting a lot of really good recommendations together. So that's a great source to reach out to if you're in a bit of a different kind of business and you want some help.
Sorry, Kira, as you mentioned that, your audio cut out. So that organization, or?
I'd say that the provincial organizations are a really great resource if you are a member of a provincial organization. A lot of them have been doing some really great work around developing guidelines to help their members.
Right. So part of that question that came in from the martial arts studio was talking about if it's going ahead in the Lower Mainland, can it also go ahead here? And just to confirm, the approach is province-wide at this stage. This morning, the Alberta government announced staged openings for Calgary and Brooks that will be less than in some other centers, but in BC so far, it's province-wide, correct?
As far as I know, it is province-wide in BC. Yep. But as we've mentioned, things change very rapidly in the current situation.
Right. Next question, and Shawn, I'll come back to in a moment. Some grocery and retail stores will be requesting customers to wear their mask when shopping. And again, this may or may not be an area that you're responsible for, and you get into that consumer confidence and people making their own choice. How enforceable is this if a customer does not want to wear a mask? Can the store refuse entry?
Well, can the store refuse entry is not technically WorkSafe jurisdiction, but that said, to the best of my understanding, stores are entitled to refuse entry to someone who puts their workers at risk, and we certainly would, because asking the customers to wear masks is to protect their workers. WorkSafeBC would certainly see that as a positive step in terms of protecting their workers and doing their due diligence. Sorry, that was a little, did that answer the question?
So I guess then, and Shawn may want to jump in as well. Let's come back to the other example we answered earlier, the hairdressers and the personal services. A lot of what they're asking is, will I be required to wear a face mask, a non-medical mask, and will I be required to tell my customers they also have to do that? That's what they're lingering and thinking might be coming out. So if you could make a comment, kind of building on that of what will be required and then what will be recommended or best practices.
So as far as required, it's difficult for WorkSafeBC to require anything that's not currently in the regulations. So a lot of it's going to be guidelines specific to your industry. That said, I am going to see my hairdresser next week because my hair is entirely too long to stand at this point, and so I will be wearing a mask when I go to visit him, just because I want him to be able to safely take care of his staff and all his other clients as well.
Yeah, but the shop owner is wanting to know, as will potentially some independent contractors that work as hairdressers, will they be having to advise their clients that be prepared, you will need to wear personal protection?
Again, I don't know that that's going to be a hard requirement coming from WorkSafe, but it's certainly a best practice that they would want to look at and have a reason why they weren't following it if they came up with another route to protect their people.
So the expectation there will be some clarity around that, and maybe it's just articulation of what you just said coming out in a short time.
Yeah, that'll be correct. On the upcoming plans, we'll be talking about respiratory protection and how to use it and how to clean it and maintain it. One of the challenges, obviously, is people believing that the respirator actually protects them from COVID, and a lot of times it's the other way around. The respirator prevents you from exposing somebody else. So it's a matter of what the plan will look like for that industry. We would always like to go to engineering controls. Is there a way that you can actually alleviate any exposure risk? But then we get down to those administrative controls and PPE. And that's why PPE is at the bottom of the list as an example. But and we'll work with industry around how they're going to implement those changes. If they can't have social distancing and they can't put barriers up because you actually have to cut the person's hair, then what do we do, and where do we go with relation to protecting both the client and the worker as you cut their hair? So more to come on the respirator side of things, and hopefully we'll have that early next week.
Great, thanks. And Jeff or Mark, if you want to jump in at any time, we'll still work through the questions. We've got about 20 minutes left. What's the best way to calculate occupancy in a retail space to define if I'm reducing by 50%? Is it pure measurement expectations there?
Sorry, my sound went really bad and I did not hear that question. Can you repeat it?
So the question, and sorry, Shawn, I had you muted there. What's the best way to calculate occupancy in a retail space, given some of it's occupied by the retail items? Any guidance you can give?
Unfortunately, I don't have any specific guidance around that. I mean, again, you're looking at overall physical distance.
Mm-hmm.
retail items certainly would take up part of the space, but what you're looking at more is, you know, can you keep people 2 meters apart at least? And you know, some smaller stores, even though they have plenty of space to keep people 2 meters apart, there's one store I go to that limits it to 1 customer at a time when I stop in to pick my groceries up. So
Great example. Thanks. Is there a concern about the clothing items, and this was something was referenced earlier, once they've been tried on, not purchased? What's the risk associated with those garments or expectations on the retail side? I think there was an example, Kira, that you had used. And that can happen, right? It's a point of contact. Is that an area that the associations, retail associations, or WorkSafeBC is involved with? Either one of you.
yeah, we're not currently involved as far as I know, and I would have to actually do a little more digging. My understanding is that most coronavirus type viruses survive on cloth fabric surfaces, but I don't know if there's been a lot of research as far as COVID.
And I think just for some guidance, what we're hearing as well in the retail sector is that's a good example of your environmental controls, that you have sanitizer available at various locations for your staff or your employees, and hand washing, right? It's personal hygiene. So having your plan addressing personal and environmental hygiene and how you can deal with that will go a long ways to helping you move forward. I'm just reading these off. Advice regarding checking employees' temperatures prior to the start of a shift. We've seen, we're exposed to the American media on this question, I think, where on some occasions the temperature of employees is being gauged. Has there been some discussion of that? Recommendations, guidelines, orders? Can you make a comment about checking people's temperatures?
Someone ran and got one.
Yeah, we do have, the oil and gas sector is doing that up in the northern part of British Columbia. And we have some of the larger manufacturing plants are using some of those. I think that has to be going, you know, you want to take that through your health and safety committee and make sure that everyone's comfortable with that process, because you don't want to impede on someone's rights and how that information is being used by the employer. And so it also runs along a line of not only health and safety, but also labor relations.
Excellent. All right. I'm just going to move on to the next one. We're still getting, yeah, I think it's, I'm just trying to solve the audio problem. Yeah, I think it's, Shawn, you might have some other folks in your offices kind of leaking in there. So do you have a disinfectant spray that you would recommend other than Lysol wipes? And if anybody can find a Lysol wipe, please let us know, because there's not a ton of it. But there is guidance out there, correct, Kira, with respect to the kind of products that you're likely best to use?
Yeah, there is guidance out there. I'm trying to remember, I believe, I'll double check, but there is a website out of the States that lists the best disinfectants in terms of all kinds of, oh, EPA, that is exactly the one I was trying to remember. Thank you, whoever just posted that.
There you go.
And it's got a great list there.
Next question, are there resources on how to develop a health and safety committee? There was some reference, I think, in your presentation, the joint health and safety committee. Many small businesses hadn't considered that if they've got, you know, a few employees. Some thoughts around that? Maybe this is an opportune time to actually raise the bar in that area. Kira or Shawn?
Yeah, absolutely. So the requirements around health and safety committees are basically with 20 or more workers, you need to have a health and safety committee with at least 2 worker reps, at least 4 members, and more worker reps than managers. With 10 to 19, you're going to want to have a worker health and safety representative at the regular safety meetings. It's just intended to kind of try to get the most effective way for your workers to raise health and safety issues. Now, if you're less than 20, there is nothing stopping you from putting a health and safety committee together. You're certainly not required to, but there's absolutely nothing stopping you from doing that and making sure you get some regular worker input that way. And there is guidance for it on our website. There is online training available in terms of how to put it together and how to actually manage it and develop your terms of reference. And I'd be really happy to send you some links for that along with the other links I'm going to send you, Dan.
Excellent. We have lots of questions still available, but time will grow short. I do want to advise those that are still participating and have submitted a question. We will capture them and then attempt to get the answer and then post that on our website or get the information back to you. We will record this, and I want to give all our panelists a bit of time to wrap up. So we'll take a couple more questions here. A question from Lindy. I would like to know about WorkSafe claims for contracting COVID in the workplace. Will employees be able to claim that they contracted it in the work? And if so, is there a process that would likely unfold? This may need to get answered before a short time, but you may not have an answer to that at this particular. But Shawn or Kira, if you have a comment on that.
Well, long story short, yes, there is. If you contract COVID at work and need to take time off as a result, you can submit a claim to WorkSafeBC. It's through the normal claims process, and on the claims website there is a COVID claims FAQ, or frequently asked questions, I should say.
And then just subsequent to that, we had another similar question of determining where that actually might have taken place. I'm assuming it would be like any other investigation. Did it occur in the workplace or outside the workplace? And it would prompt an investigation.
Yes, yeah. When a worker gets injured, whether it's communicable disease or infectious disease or a physical injury, the employer should investigate those and have a look at what are the contributing factors and then how to control that. That helps strengthen their program as it relates to exposure risk and what they need to do to ensure they can engineer out the problem. The employer wants to ensure that if someone's filing a claim for COVID-19, that they can look and say, is it likely that this occurred in the workplace? And they'll have to show that, same as on the worker side.
We have a question, and it was addressed a little bit earlier, but I think it's worthwhile to potentially work towards wrap up here. And it's the roles and responsibilities in the workplace. When the employer believes they've done everything they've could to create that positive work environment, or and the employee still is not comfortable, is there an expectation that WorkSafeBC is somewhere along the line going to say, okay, you're good to go? Or is it an expectation that employees, if they don't feel comfortable, they should be reporting? Just to illustrate that a little bit more and to expand on that, I think what we heard earlier was there's no thumbs up that's going to come from WorkSafeBC, but there is an expectation of following some general guidelines. Kira and Shawn?
Well, I mean, broadly speaking, our officers are available for consultation, and they also will be getting out to look at the workplaces generally in line with what public health is recommending. Are you following some best practices? Are you taking reasonable steps to protect your workers? But again, yeah, we're not going to be ultimately requiring or blessing a specific plan. If an employee does feel uncomfortable, they feel like there's something missing, they do need to let the employer know what specifically their concern is so the employer can address it. They can't just say, I'm kind of nervous about COVID. What is it that the employer is not addressing in terms of their potential exposures that the employer can look at? And then they would go into a refusal of unsafe work, which is under Section 312 of our regulations, and go through that three-step process that I told you about, where investigate with the supervisor and employee, investigate with a worker representative, and then call in WorkSafe to determine if there is in fact an undue risk or not.
Right. I just want to go to Mark and Jeff just to wrap things up from their perspective. Any lingering issues that you're hearing that might be useful to follow up with Shawn or Kira here. Mark, from your members' perspective, just before we wrap up at the top of the hour here.
I think the big thing, and it's the one thing that people talk about, and I think we all are looking for it, and it's called guidance. People just want to, who own businesses, want basics, and it's encouraging to hear us to use, probably your intuition is going to tell you what you should be doing within your own business, no matter what sector that business falls in. There's a lot of information out there, but once WorkBC starts to have that kind of guidance on their website, it's going to be extremely helpful. We have some in the Downtown Kelowna Association that we've sourced that are third-party kind of guidelines that are basically pointing out the same things that we've talked about here today, and they're available on our website under our resources tab, as well as the Chamber of Commerce's Fab 5, which is very effective.
Jeff, some final thoughts or comments for takeaway?
I would just echo that. I think having a standard set of protocols that businesses can follow is going to both make the business more confident and also consumers more confident. I think there's value in having people doing things the same way. And so a good example would be package deliveries. I spoke with a couple courier companies. They love it when they show up at a business and there's a little pedestal or table right by the door with a label that says packages here. And that table is, invariably 10 feet away from reception. It's in a safe space. And they've noticed that kind of picking up as a trend. And if every business did that, it would be a very simple thing for every courier to know. Every courier goes in to pick up or deliver, and the package is waiting in a safe spot. And I'm not sure whether you can do that from top down or whether it's organic, but definitely that kind of regular practice. And so if takeout businesses are all serving the same way, everyone has a sign saying, please wait outside the door until the counter is empty. Things like that, I think, are incredibly helpful, and they're going to drive consumer confidence, which is going to get us back on our feet.
That's a great comment, Shawn. Just I'll turn it over to you and Kira. And Kira's off camera just on capacity, but we do have her voice joining in. So I think what we're hearing a little bit, Jeff, in some of the comments, some of this will be organic and expectation. Government won't be telling everyone to do thou shalt, but it's a great example, I think, that Jeff talked about of there's an element of creating consumer confidence, that best practices and those that respond to create that consumer confidence will make a difference. And sharing that information, so it's a good way to kind of wrap up. And I'll give you some time, Kira and Shawn, just to summarize a little bit and some takeaways before we close things off this morning.
Yeah, so I just want to thank everyone for the opportunity to come and speak with you. There's some good takeaways for us. To Mark and Jeff's comments, your business, your people. There's no doubt everyone cares about each other. So the biggest challenge is already taken care of. Is the care is there, the interest is there, and the drive is there to make the change and do what's right to put things in place. So we're going to work hard. We've still got some things to do around guidance, and we're still every day coming out with new information. Industries, we encourage industry to go to our website and keep up to date on that, and gather the information they need to help them. And then we hope there's only a limited number of us WorkSafe people, but we hope that we are available to get out and provide that consultation and have a chance to have that conversation with you around where do we take it and how do we get there together. So I appreciate the opportunity to have this discussion, and we've got a lot to work to do, and we hope you have the opportunity to help you build that consumer confidence and be back strong and doing what we need to do for British Columbia.
I'd just like to reiterate what Shawn said, in that you guys know your businesses better than anyone else, and your team, your employees, your staff team better than anyone else. So you ultimately pay with some help and guidance from us the best ways to keep your people safe. But don't be afraid to reach out to WorkSafe. We are keeping our officers on the ground as much as we possibly can to get out and help support you. But even if we're not, necessarily able to get out there right away, please call our prevention line 1-888. Again, 1-888. ask any questions that you need to ask, because we are here to help you as best we can.
Shawn, I'm going to ask you to jump in because it was just to repeat the number, because Kira, you cut out both times when you were giving the number. I know it was on the slide deck, but Shawn, you just wanted, for those that have joined us, the best way to get in touch with you?
Yes, you can call us anytime at 1-888-621-7233. And that's our call-in line, and then that'll get referred to an officer to make contact with you and have that conversation.
And you cover the Okanagan and Kootenay regions?
That's correct.
Great. So you're in contact. We'd like to extend the opportunity to bring you back in a couple of weeks. We had great interest, more than, well, at one point over 250 that joined us this morning. So we'd be willing to come back and share some experiences in a few weeks.
Absolutely. Yeah.
Awesome. Great. I want to extend our thanks to Mark Burley, the Executive Director for Downtown Kelowna, a large membership, anxious to get going and providing services downtown. So we look forward to some of that activity downtown. And Jeffrey Robinson is the President of the Kelowna Chamber of Commerce. Jeffrey and Mark, thanks for joining us this morning.
Thanks for having me, Dan.
All right, I'm going to wrap things up. I want to thank both Shawn and Kira, the co-managers for the region, for the Okanagan and the Kootenays, for WorkSafeBC as prevention managers. Just a couple of comments and notes to finish things off this morning. I did want to reflect that our Business Smart series will continue next week as we get into our look at crime prevention, protecting fraud. There was some interesting news of how much there's been an increase in fraud because of COVID-19, working remotely. So is your business protected in this day and age from potential fraud? That's next week. We'll have representatives from CIBC joining us to talk about ways that you can do a better job in protecting your business from fraud. And coming up on Monday, May 25th, just to hold the date note, we have Federal Minister Mona Fortier, the Minister of Middle Class Prosperity and the Associate Minister of Finance, as part of our monthly Okanagan School of Business online speaker series. And during the COVID pandemic, we are providing all our programs and services to everyone currently at no cost. We can only do it because of the support of organizations like the Okanagan School of Business. We're looking forward to chatting with the minister to talk about the federal response to COVID-19, but also look long-term, who's paying the bill at the end of all this. The Associate Minister of Finance, Mona Fortier, joining us on the speaker series. To wrap things up, I want to thank all of those that have joined us for the speaker series, our panelists, and all of those that have joined us. We hope you have a safe and great weekend. Enjoy the long weekend in beautiful Okanagan.
Thanks, Dan.